So a couple of important specialized tests that are important to remember with the elbow. One is assessing the UCL, both for pain and integrity. And this can be tough, but very similar to when you're doing collateral ligaments in the knee. You want to make sure you have a bend in the elbow, somewhere around 15 to 20 degrees, and then your palm right on the joint, so you stabilize the joint, and then you can provide a valgus stress test while you're stabilizing the joint. And the questions are, is that painful? And then I'm feeling to see, is there any significant ligamentous laxity? Does this ligament open up like a book or partially open up, which would concern me for potentially higher grade injuries than if there was just pain. And of course I can compare it to the other side, and she has good ligamentous integrity on both sides. She has no pain. That's totally normal. You can do a varus stress in the same way, but it's, the lateral ligaments are not really anything we worry about too much, but you'll bend and make sure you have the arm rotated around the right angle there. You don't want to be in a situation where you're trying to do stress testing and the arm's sort of rotating on you. So that's one sort of pitfall there with the exam. A couple other things that we commonly do, particularly in our throwers. One of them is sort of putting the elbow in this position, the milk test. It's almost like I'm milking her thumb here, and then just relax. This is purely passive. I'm holding her here, and again, I'm putting stress on that UCL. In the case of an open growth plate, I'm putting stress on the medial epicondyle apophysis and seeing if that bothers the patient there. Another one that you can do, again related to the medial epicondyle, is doing bending the elbow here and then doing a passive extension and really putting the flexor mass on stretch there up against the medial epicondylar apophysis to make sure that doesn't cause any pain for them. You certainly can do resistance as well. So having her flex the wrist up against my hand is going to be activating that flexor mass, and then rotating this way, having her extend the wrist up against my hand. You can see the lines of her muscles going out this way to the lateral epicondyle, which is another area that can be affected in folks that have lateral epicondylitis, tennis elbow, etc., and making sure that that's not painful at all. So one other specialized test to look for any sort of nerve involvement, particularly of the ulnar nerve as it runs through the cubital tunnel, would be Tunnell's test, where I'm going to find the cubital tunnel, which is one of the areas you want to palpate as well. And once I'm underneath that cubital tunnel, which she has a nice groove there, then I'm going to palpate and see if she's having any numbness, tingling, radiating all the way down to her hand, particularly in the distribution of the ulnar nerve.